Dr. Simons, a vascular surgeon at UMass Memorial Medical Center. On behalf of our team, I want to thank you for choosing us for your care. At UMass Memorial Health, we believe that this is the best place to get care and the best place to give care. The following video will help you better understand what will happen before, during, and after surgery. Thank you for trusting UMass Memorial's Division of Vascular and Endovascular Surgery for your care. In terms of your preoperative planning, after you've made the decision to have surgery, our office will reach out to you to confirm a date for surgery and to give you additional information about what will happen before surgery, including your pre-surgical evaluation. About 7 to 14 days prior to your surgery, you will meet with our pre-surgical team at the Memorial Campus at 119 Belmont Street in Worcester. During this appointment, you will meet our anesthesia and nursing teams. You'll have lab work completed, have an EKG done if needed. We'll review your medications and health history and give you a physical exam. Be sure to bring an up-to-date list of medications with you. We will review what to expect during your procedure and ways we will take great care of you after your procedure. You will get a phone call the day before your surgery with an arrival time. This usually occurs sometime between 6 a.m. and 11 a.m. We will explain when to stop eating and what medications to stop taking or keep taking before surgery. If you're on blood thinners, this plan should already be in place prior to your procedure, as you may need to stop taking them depending on what type of surgery you are having. In terms of the day of surgery, you'll come to the university campus at 55 Lake Avenue North. You will use the Remillard Pavilion main entrance and follow the signs to the D elevator to the second floor. This is the surgical admission area where your family can wait during surgery. When you arrive, you'll see the nurses and the anesthesia team. They will place IVs, possibly a line in your wrist that measures your blood pressure. Your vascular anesthesiologist will make sure that you are very comfortable and send you off to sleep. Your operation can last anywhere from 4 to 6 hours. After your surgery, your surgeon will reach out to your family to let them know that you're doing well and in the recovery area. We will let them know when and where they will be able to visit you. Post-operatively, you'll go to the post-anesthesia care unit or directly to your hospital bed, depending on your operation. Our vascular team, including nurses, patient care associates, and case managers, will be with you throughout this process and begin to help plan your discharge. Some mild discomfort can be expected after surgery. Medications and other interventions can keep you comfortable. It's not unusual to have some numbness at the surgical site also. This usually improves over weeks or months. After surgery, we will ask you to move around as much as you can tolerate. This improves circulation and helps prevent complications after surgery. We implemented an eye cough practice to help prevent pulmonary complications such as pneumonia, blood clots, and other lung or breathing problems. The I in eye cough stands for IS device. This is your incentive spirometry device. You'll learn how to use it, which is critical to your recovery. The C stands for coughing and deep breathing. You want to do this several times a day to help your lungs expand. O stands for oral care. Brushing your teeth and using mouthwash should be done twice a day. U stands for understanding why these steps are important to your recovery. G is for get out of bed. We want you to get up and moving as soon as possible to help prevent things like blood clots from forming and to help speed up your recovery. H is for having the head of the bed elevated at least 30 degrees to help you breathe. Our team will make sure you and your family have all of the tools available to help prevent complications. Your commitment to your recovery is very important. In terms of your discharge, our office is going to call you about 48 hours after you're home and ask you a series of questions regarding your recovery and allow you an opportunity to express any concerns. A nurse practitioner or your surgeon is available if any concerns need to be escalated. Once you go home, you may resume normal activities as you feel you are able. You should be up and walking around your house several times per day. Walking outside and doing stairs are acceptable, and you can increase your activity as you can tolerate. Avoid aerobic exercise other than walking until your follow-up visit, which is usually about 2 weeks after your surgery. You may return to work or school as you feel you are able to do so. There should be no driving for 24 hours after surgery and never while taking narcotics. If you have dressings over your incisions, keep them clean and dry for the first 48 hours. Don't shower at this point. After 48 hours, you may remove the outer bandages over your incisions and shower. You should wash and dry the wounds gently with soap and water. No dressing is needed after 48 hours. Don't soak in a tub or a pool though for at least 2 weeks following surgery. As far as your diet is concerned, there are no restrictions. You may want to start with small portions of bland foods that are easy to digest for the first 2 to 3 days. You should keep well hydrated as your body is recovering. Try juices, water, broth, sports drinks. Having surgery and taking narcotic pain medications can cause constipation. Here's what you can do. Start taking a stool softener, Colace, or generically Docusate sodium, starting the day before your surgery. You should take 100 milligrams of this twice daily. If you go more than 2 to 3 days without a bowel movement, you should take 2 tablespoons of milk of magnesia 3 times per day until your first bowel movement. We're here for you 24/7. Please contact us with any questions. Hi, my name is Dr. Simons, and I would like to talk to you about your carotid endarterectomy procedure. The procedure, also called CEA, is done to treat carotid artery disease. The carotid arteries are the main blood vessels that carry oxygen and blood to the brain. In carotid artery disease, these arteries become narrowed due to a blockage. This reduces blood flow to the brain and could put you at risk of having a stroke. Because of this, your team has decided that you would benefit from a carotid endarterectomy or a carotid stenting procedure to fix this blockage. The carotid endarterectomy procedure involves the surgeon making a small cut or incision on the side of the neck over the affected artery. It's about 2 to 3 inches in length. Then the surgeon will surgically remove the plaque that has built up in the carotid artery. When done, the surgeon will close the incision. The carotid stenting procedure involves your vascular surgeon inserting a slender metal mesh tube called a stent, which expands inside your carotid artery to increase blood flow in areas blocked by plaque. The procedure can be done while you are awake or asleep. I will now turn the conversation over to Lisa Arello, our nurse practitioner, who will discuss what to expect after surgery.
Thank you, Dr. Simons. Following your procedure, you will have an incision about 2 to 3 inches in length on the left or right side of your neck. If you are having a carotid stent placed, you will either have a puncture site in your groin or incision above the collarbone. After the procedure, you will be immediately taken to the recovery area. The nurses here are wonderful. In the recovery room, you will be closely monitored for at least a few hours, making sure that you are comfortable and that your vital signs are stable. You'll be getting pain medication through the IV if needed. The nurses will also perform hourly neurological assessments on you. From the recovery area, you will go to the step-down unit where you will continue your recovery. You can expect to be here 1 or 2 days. Our team will give you whatever you need to assist in your recovery. When you are discharged, you will receive instructions about caring for your incision site, medications to take, and instructions for your follow-up appointment in the office, as well as important signs and symptoms to look out for. You can expect to have numbness along the incision line, under the jaw, and often involving the earlobe. This numbness is due to the cutting of small nerves that provide sensation to the skin. The sensation to this area will gradually return within 6 to 12 months, but sometimes does not. Your scarring will take 6 to 12 months to fade. Once you are home, you can shower, but it is important to keep the incision area clean and dry. For men, no shaving until seen for the first post-operative appointment. Our office will see you within 1 to 2 weeks. You will also have follow-up imaging studies to monitor the repair. Dr. Simons, do you have anything to add?
We want you to look out for certain symptoms after surgery and call our office should you have them. Your incision can be tender, swollen, or bruised, but there should be no difficulty swallowing or breathing. If there is, you should call the office immediately, as this could be a sign of bleeding under the skin, compromising or obstructing the airway. It is not unusual to have a small amount of drainage from your incision, but the drainage should stop in a couple of days after the surgery. If you continue to have drainage, or it suddenly increases or changes in color, please contact us. It is important for you and your family to be mindful of signs of a stroke. Use the FAST system to help you remember. F is for face drooping. One side of the face is drooping or numb. A is for arm weakness. One arm is weak or numb. When the person lifts both arms at the same time, one arm may drift downward. S is for speech difficulty. You may notice slurred speech or trouble speaking. The person can't repeat a simple sentence correctly when asked. T is for time to call 911. If someone shows any of these symptoms, even if they go away, call 911 right away. Make note of the time the symptoms first appeared. Again, we would like to thank you for choosing UMass Memorial Health's Division of Vascular and Endovascular Surgery for your care. We're here for you 24/7. Please contact us with any questions.